Louisiana reporting its 16th child death from COVID-19 today. Missouri reporting its 6th earlier this month. In total, there have been more than 450 children who have died due to COVID-19 since the pandemic began. KQ2's Madeline McLean spoke to Children's Mercy's top infectious disease doctor to ask how this compares to a typical flu season.
Since the beginning of the pandemic, one persistent myth that won't go away is that COVID-19 poses no more risk to kids than the flu.
That is not true.
At local school board meetings, parent after parent repeats the myth as the reason children shouldn't be in masks.
There's a higher risk of dying from the flu.
Kansas City's top children's doctor studying and treating infectious diseases says that's just not true. It's also not true that COVID-19 only affects kids with underlying or chronic conditions.
I'm seeing healthy kids in the hospital with COVID-19. I'm seeing healthy kids in the hospital in the ICU with COVID-19.
Here are the facts. You're 10 times more likely to die from COVID-19 than the flu. That's because COVID-19 is more contagious.
If you have a more contagious virus, then more people are going to get infected. If more people get infected, more people are going to get seriously ill and then die.
Since the beginning of the pandemic, there have been well over 450 children's deaths due to COVID, compared to a typical flu season where about 100 to 150 kids die from the flu.
It's a year and a half, but even if you took out 6 months of that, that's still well above that mortality rate.
Dr. Angela Myers of Children's Mercy says that it's clear that COVID-19 is more deadly than the flu for both children and adults. But she also says the flu is not something we should just be ignoring.
The death rate is much smaller for flu in kids than it is for adults, but 150 deaths is still 150 deaths. And that's, too many to me.
Other countries take it seriously. They get immunized and use mitigation strategies like masks.
So in Asia, one could argue they were on the ball quicker than we were. They do wear masks during a typical flu season. And we just, as Americans, had not ever kind of adopted that. Had we done that before the pandemic, would we have had less flu cases and less flu deaths in our country? Perhaps.
Dr. Myers says perhaps it's time to put two myths to bed and start taking the flu and COVID-19 more seriously, especially when it comes to children. Reporting, Madeline McLean, KQ2 News.
Children's Mercy also saying another myth you should ignore, that masks don't work. Myers says they work at protecting children from COVID-19, flu, and RSV, and they also keep kids in school.